Good morning, everyone. Can we call to order I will call to order the Joint Subcommittee on Human Services. Madam Secretary, please call the roll.
Assemblywoman Anderson. Present. Assemblywoman Dickman. Here. Assemblyman Hafen. Here. Assemblywoman Howdigy.
Here.
Assemblywoman Monroe-Monreno.
Here.
Assemblyman Watts.
Here.
Assemblyman Yeager. Senator Canizaro. Senator Dondero Loop.
Here.
Senator Severs-Gansert. Senator Titus.
Here.
Assemblywoman Garlow.
Here.
And Chair Wynn.
Here. And if we can mark Assemblyman Yeager, Senator Canizaro, and Senator Severs-Gansert present when they arrive. I know they're running a little bit late. Good morning, everyone. I'm excited to be here this morning. I'm going to get started. I just remind everyone to please silence their cell phones and electronic devices, and we will have public comment available at the end of the meeting after the budget presentations. At this time, I'd open the budget hearings for the Department of Health and Human Services, Division of Public and Behavioral Health. I will say there are 12, and I'm sure everyone saw that, 12 budgets on the agenda today. So 12. So I like the color coordination here amongst the women at the table here. This is fantastic. I don't know if that was planned, but it's great. And it is Wednesdays. Wednesdays we wear pink. Is that what it is? Is that what's happening here? Anyway, well, welcome here, and I'll remind everyone, and there may be a time where I start to nudge you forward on some of the budgets just so we have so many to get through, and I want to make sure that all of our members get their questions answered. And I will turn this over to, I believe it is Lisa Sherrick. Did I say that correctly?
Good morning, Lisa Sherrick, allegedly with a K at the end, according to my husband, Administrator for the Division of Public and Behavioral Health. Here with me today is Ms. Cody Finney to my left, Debbie Reynolds, Deputy Administrator for Administrative Services. Apologies, Cody is over Regulatory and Planning Services, and Julia Peak, Deputy Administrator over Community Health Services. So I'm just going to very briefly go over slide 2, 3, 4, 5. That's our org chart, agency operations and sections, overview of our budget, and budget account summary. We went over that in the pre-session, so I don't think it's necessary to go over that today. Moving into slide 6. Is our child care services. The mission of the child care licensing is the promotion of the healthy development and protection of children through regulation, licensing, and education. This is accomplished through assessing regulatory compliance of child care facilities and institutions during periodic inspections and complaint investigations. This program must also adhere to compliance with standards established in the Federal Child Care Development Block Grant. Moving to the next slide, this includes 5 additional child care licensing surveyors in E225, as well as transferring the entire budget account to the Division of Welfare and Supportive Services to consolidate child care related programs, creating efficiency. Additional positions are needed to assist in the increasing and evolving workload of child care licensing by ensuring the health, safety, and proper treatment of children within child care is done efficiently through monitoring, completing risk safety assessments, investigations, and inspections. And with that, are there any questions on this budget account?
Thank you for that brief and thorough presentation on this budget. I believe we have a question from Assemblywoman Anderson.
Thank you, Chair, and I did not get the pink memo, but thank you very much for the coordination. When it comes to the, again, E225 budget, how is it determined that 4 child care surveyor positions and 1 child care facility surveyor supervising positions is needed? And would this actually allow for the agency to meet the workload in regulating the child care providers?
Good morning, Cody Finney for the record. Thank you, Chair, through you to Assemblywoman Anderson. The staff in this program did do an analysis to ensure that that was the appropriate number of additional staff and the appropriate types of staff. They have taken on some additional responsibilities in the last several years, and this will allow them to keep up with that work.
I think we have another question from Assemblywoman Howdigy.
Thank you, Chair. And I just have a quick question, and this would have probably been better for last week's presentation, but why would a child care facility be licensed with the state and not with the local government? I know that you guys license child care facilities that have 5 or more children, correct?
Cody Finney, for the record, Chair Wynn, through you to Assemblywoman Howdigy. Thank you for the question. I'm struggling a tiny bit with the why. There are, in Washoe County, they do their own child care facility licensing. The state does a portion of it. It's possible for local authorities to do this. It hasn't been implemented at this point. Does that help?
Yeah, okay. And then I do have another question, Madam Chair, if that's okay. I just want to go to the transfer of the child care service budget. How will the agency communicate the change in oversight to existing providers?
Cody Finney, for the record. Thank you, through you, Chair, to Assemblywoman Howdigy. There are regular communication processes that the Bureau uses to send out listservs and do trainings with the providers, so that will all be communicated in those regular structures. I will say it should be fairly transparent because the people that the providers are contacting won't change, and the office space won't change in the immediate future, and the phone numbers won't change. So we will have that on our website. We will have that communicated through listservs and trainings, but the impact to the providers should be fairly minimal.
I have a question. I know that part of the reason for this additional 5 positions is it's my understanding that they are, the services is responsible for an additional 476 additional facilities that they will monitor. That seems like a lot. Is that 5 positions like sufficient to cover those additional almost 500 additional facilities?
Cody Finney, for the record. Thank you, Chair Wynn. The additional, I think, almost 500 that you're referring to are the out of school programs, correct?
That is correct.
Yes, so they've taken that on, and the analysis is that this amount of staff will be sufficient for the folks for the program to keep up with that entire workload.
Thank you. And do we have any other questions about this? I think Senator Titus, go ahead.
Thank you, Madam Chair. And again, thank you for this. I'm just curious, and I'm going to ask this question frequently of agencies, and I've already asked it. You're asking for 5 positions. Can you fill them? And what's your vacancy in the positions you already have?
Cody Finney, for the record. Chair Wynn, through you to Senator Titus.
I'm sorry. Feel free to go directly to the question and answer.
Thank you very much. We believe we can fill these positions. I do not know the rate of vacancy of this group off the top of my head, but we will get that for you. Thank you.
Sorry. Lisa Sherrick, for the record. So currently we have 20 FTEs and 17 are filled.
That's actually a pretty good ratio, so hopefully it can fill these if they're granted. Thank you.
Do we have any other questions regarding this budget from the committee? Seeing none, thank you for that presentation regarding that budget. And if we can move on to the Nevada Central Cancer Registry, budget number 1013153, and begin when you're ready.
Okay. Lisa Sherrick, for the record. So even though there are no enhancements in this budget, we did want to provide an update on their cancer registry program based on legislation approved last session and implementation status since that time. In the 81st session of the Nevada Legislature, they approved Assembly Bill 471, and this established approval of a new fee revenue to sustain the cancer registry without the need for state general fund and sole reliance on insufficient federal grant funding or ongoing state general fund. Regulations were filed with the Secretary of State on December 29th, 2022, which authorized an additional 6% be added to the Healthcare Quality and Compliance Program and radiation control licensing and renewal fees. The current revenue projections for health facilities under HCQC are $15,000 between January of this year through June 30th of 23, and we anticipate a significant increase to approximately $125,000 in the fall of 23 when renewal fees are due. The actual health facilities revenue will likely be higher, as it will also include fee revenue from the initial licenses. Current revenue projections for mammography machines are approximately $1,200 between February of this year through June, and then approximately $107,000 annually once radiation-producing machines are added to the regulations. Recruitment for one of the two positions is anticipated to be hired before June of this year, and we project adequate fee revenue to hire the second health program specialist one in October of 23, while maintaining an adequate minimum reserve, though we could hire the second position sooner if federal grants are available. And with that, happy to answer any questions.
Thank you. And I know you guys have been moving, as this is a brand new registry, is my understanding, and it just got off the ground, I think, in December. Is that correct? Or a brand new fee. I'm sorry. Brand new
So
fee.
share for the record, yes, the
Losing my
fee.
mind. I think we do have some questions, and I think I will go to Chair Gorlow.
Thank you very much, Chair Nguyen. Thank you for being here. It looks like, according to my backup documents, that you're expecting a range of about $125,000 to $155,000 collected in these fees. Is there a plan in place that if you don't make those numbers, what you will do to make up that lost revenue?
Julia Peak for the record. Thank you for that question. So this has been a long-standing registry. I'll just say, and I want to put on record that this team met gold certification. No, that's not your question, but they work incredibly hard. We do have the federal grant. We've been given permission to ask for more grant funds, though it will likely be denied, but we do plan to ask for it. We also have the public health infrastructure grant that's really intended to ensure that we can retain or get staff. So that's our backup plan should the fees not come in as expected, but we have those two grants potentially to support it if we don't.
Thank you very much, and congratulations on your certification.
And I think, Senator Titus, did you have a question regarding this?
I did. Thank you, Madam Chair. And again, Ms. Peak and I have met many times and spent lots of hours making sure that this registry is successful and succeeds forward, getting this data that's critical to the future of Nevadans and everywhere, actually. What this cancer registry does is help get information on locations of cancers, maybe new cancers, and I think it's just important for Nevadans and, again, all citizens. Having said that, however, I'm worried that has data been people putting data in now? I'm worried that if you says that you have two existing spots, but they're vacant. Who's been doing the data entry now?
Thank you, Senator Titus, and thank you for working on this registry for a very long time with me. So we do have temporary cancer tumor registers right now working on it. Our intention is that they no longer remain temporary and become FTE positions.
So that's how you're going to be able to find the personnel
exactly.
to fill this?
We
Okay.
hope they'll apply. Exactly. Julia
Yeah.
Peak for the record. There is hope that our temporary staff would be interested in applying for the state positions once opened. So we don't see a huge challenge in recruiting for the positions. As I said, they've been doing it this past session, and we did get gold standard. As for the data, since we met gold standard, it will be in national statistics, and when we don't meet it, Nevada is blank on the map, and so we're really happy that we got it as far as the usage of the data.
Great. Thank you for that. Very encouraging and nice to know that all the hard work is right there being successful. So thank you. Thank you, Madam Chair.
Do we have any other questions regarding this budget? Seeing none, we'll move on to 3190.
Lisa Sherrick for the record. Slide 9 is an overview of our Office of Vital Records, which manages birth and death certificates. On slide 10, we are requesting E225, which is one new accounting assistant to assist with fiscal duties, and E226 to request a new administrative assistant to process birth certificates. And then on slide 11, we're requesting 3 new management analysts to support Vital Records. The additional oversight of current administrative staff is extremely important, and the additional staff is required to complete the increasing workload. One of the MA positions has been a contractor since 2008, and the other since 2019, and we're requesting these positions change to FTEs as they will be needed indefinitely based on to maintain the current levels of productivity. And with that, I'm happy to answer any questions.
Thank you. I know that when I talked to you all about this, I was curious to see most of the conversations we've been having around budgets is moving full-time positions into some of these contract positions to get retirees to come back. And so I was happy to hear that we have 4 great people that have been there long-term that want to continue to stay there. I think we do have a question from Assemblywoman Monroe Moreno.
Thank you, Madam Chair. An easy question. When I look at my backup documents, it appears that there will need to be a technical adjustment to remove the contract positions for the cost offset for the state positions. Will there be a technical adjustment when we come to budget closings?
Thank you. Debbie Reynolds for the record. Yes, there will be an adjustment. We do need to remove the existing contract costs from the budget.
Thank you, Madam Chair.
And if I may, Lisa Sherrick for the record, my colleague graciously pointed out I misspoke and I meant to say 2018, and I must have said 2008. So I wanted to correct that on the record.
I will take 2018 as well. I think that's some longevity when it comes to state workers, so thank you. Do we have any other questions from the committee members? Seeing none, let's move on to 3194, the Environmental Health Services budget.
Lisa Sherrick for the record. This is our environmental health program. This program is charged with regulating various areas such as food protection, bottled water, manufacturing, temporary mass gatherings, sewage, RV parks, to name a few. Moving into the next slide, 13. E226, request to eliminate 2 environmental health specialist 3s due to the creation of the Central Nevada Health District. Environmental health is performing a workload analysis to assess our capacity to protect public health, and we are also working on a contract with either a CPA or accounting firm to assist in our fee analysis as we are unable to complete this activity due to workload and staffing challenges due to COVID. The base budget also includes an elimination of 2 FTEs due to inadequate revenue and the difficulty in filling these positions. Revenue was reduced by the impacts of COVID. During this time, we had no temporary mass gatherings or temporary events during 2020 and 2021, which significantly reduced our revenue and workload. With the pandemic restrictions being lifted, our temporary events are more frequent and our mass gatherings are returning. Losing an additional environmental health position in our base budget does put us in a difficult position to inspect facility types, which are done to protect public health. However, this is where we're at this time. And with that, we're happy to answer any questions.
Thank you. I think we have a question from Senator Dondero Loop.
Thank you very much, Madam Chair. And it's such a pleasure to see all of you in person. Like, I feel like I've been watching you on Zoom forever, and you were always in that big building, and so thank you for being here. So talk a little bit about what the projected impact is to the program's ability to complete its workload and to protect the public health as a result of the recommendation of eliminating those 4 positions. I totally understand what you're saying, but I'm also worried about jumping forward and then those positions not being there.
Lisa Sherrick for the record. I'll start and then I'll let Cody fill in any gaps. I just wanted to clarify for the two that are going to the Central Nevada Health District, they will still be conducting environmental health activities with that new health district, but I'll turn it to Cody to discuss those other two.
Cody Finney for the record. Yes, the Central Nevada Health District will take over these responsibilities for those 4 counties that they're overseeing. So we don't expect there to be a negative impact related to that. The other 2 positions, at this point, the program does have challenges to inspect restaurants, individual sewage treatment. I'm sorry, there's a real name for that. Septic systems.
You could have fooled me anyway, so.
Individual systems. And for example, schools. As an example, this week there was a request for us to go out to a school. The people in that particular region were also ill, and we did not have the ability to get out there and back them up because we just did not have the people. So that is the risk that there will be an outbreak and we won't have somebody with boots on the ground to do an inspection and make sure that the recommended cleaning is being done, or we will be slow in getting restaurants inspected and making sure there aren't vermin contaminating the food. The program, I will say, these folks work very hard and they are doing their darndest to keep up. But we believe that it will be impacted.
So, follow up, Madam Chair?
Yes, go ahead.
So could you see in the future maybe adding, I don't know, 1 or 2 back in?
Thank you, Cody Finney, for the record. Yes, the fee analysis that Ms. Sherrick referred to should help us assess.
You are in the meeting now.
Okay. You know, I like that.
I thought I was in the meeting before.
I know.
Cody Finney, for the record.
Hang around.
Yeah. So the fee analysis, yes, the fee analysis will help us to make sure that we can fee fund what we need for this program, and we would look at making sure we have the adequate staff to do all those required duties.
And the reason I sort of went there a little bit is because when you were talking about not having people to go out, down in Las Vegas, we had a huge school outbreak of, a neurovirus. And of course, we have restaurants all the time that we close. So in my mind, I'm thinking, ooh, that could be a little bit of a problem. But thank you for that answer, and thank you for what you do.
Thank you. And I think I have another question from Assemblyman Watts.
Thank you, Madam Chair. So I understand that there's just some challenges associated with this budget account. And so building off some of the other questions from my colleagues about the difficulties with the workload, I know another issue that has come up is kind of the reserve levels in this budget and related to the fee study, and also just making sure that it's solvent and stable for the long term. So can you talk a little bit more about the steps that the division's taking to ensure that it's going to be solvent long term and enable us to get the workload that we need to undertake the work?
Thank you, Debbie Reynolds, for the record. Ms. Sherrick mentioned that we are working to assess our capacity. We have a meeting actually Wednesday of next week with a CPA. We are interested in contracting with a CPA or accounting firm to help us with our fee analysis. That's already in the works. We have the contract started. We just need to work through the scope of work and then submit the contract for BOE approval.
Do we have any other questions regarding this budget presentation? Seeing none, I'll have you move on to the next one.
Lisa Sherrick for the record. On slide 14 is the immunization caseload. While we have never budgeted, in the past, we've historically budgeted the required general fund match for purchasing vaccines for Nevada Checkup in order to ensure the Nevada citizens have access to vaccinations. We are requesting to fund caseload in this budget account that can be used during each biennial budget cycle based on the Medicaid FMAP.
You know what? I noticed that this wasn't on the agenda. I think the next
Oh, it
one
wasn't?
that we are hearing is 3216.
Sorry about that.
No, that's okay.
Apologies
That's
for
okay.
not catching it. The pre-session must have explained it all. All right, so moving to slide 15 is budget account 3216. This is our health care facilities regulation, which protects the safety and welfare of the public through regulation, licensing, and education. This program also maintains an agreement with the Federal Centers for Medicare and Medicaid Services, or CMS, and completes federal certification inspections for certain healthcare facilities, medical laboratories, and issues license to certain allied health professionals. Next slide. E225 requests to eliminate duplicative regulation and barriers to the employment of medical professionals or nursing pools in Nevada. Nurses are regulated by the nursing board, and medical facilities are required to vet their staff and other regulations enforced by HCQC. The language changes are designed to capture only those agencies that are not subject to other facility regulations. And during the pandemic, it became very clear to our division that the industry is changing their business practices surrounding temporary employment, and this definition also needs to be updated because of that. I also would like to note that while our reserve levels in this budget are reducing, we do project adequate reserves to fund the budget, and we are conducting a comprehensive analysis in order to adjust fees that will support workload and associated expenses to protect public health. We are also working on establishing a contract with a CPA or accounting firm to assess our fees, and will be in our fee analysis, as we've been unable to complete this as well due to workload and staffing challenges. And with that, happy to answer any questions.
Thank you. I think one of our members had a question, but I believe you answered it regarding the solvency of that and operating on the reserves. But if we can go, I think she has several questions, but I will move to Assemblywoman Gorlow regarding the nurse apprenticeship programs. I know she has some questions, so turn it over to you.
Thank you, Chair Nguyen. Yes, I wanted to know a little bit more about the status of the nurse apprenticeship program. And if you could explain a little bit more, is this a program for, say, an LPN or an RN, BSN? What level of nursing does this cover?
Lisa Sherrick for the record. So the Nurse Apprentice Program is for students in the RN or LPN programs. And this started, I think it was last February we had the work program for this. It was a little slow to start. One of the things that we had to add, which we recognized was not clearly in the regulations for this program under the nursing board, was adding skilled nursing facilities, since that was a provider type that was struggling as well with having the necessary staffing to support their residents. So fortunately, the Board of Nursing did a regulation change that was approved. So it's taken a little bit to get the skilled nursing facilities on board, but we certainly have seen an increase month over month since the beginning of this program. So currently, there is about 44% of the eligible facilities have been enrolled in the program, and we have had 11 nurse apprentice be offered the retention payments for the facilities that they did their nurse apprentice program at. There is, based on projections for the first 9 months, it appears we're looking at about a $10,700,000 remaining that may be able to be redirected. However, this past month I have seen, I'm going to say a significant increase from the previous month. So I think that number could change a little bit as we go further into this program. There's also travel reimbursement that's provided to the student nurse apprentice, which has been very successful to get them out to the rural areas and making sure that our critical access hospitals have the necessary infrastructure.
Thank you very much, and you answered my follow-up question too, so thank you.
Do we have any other questions? Assemblywoman Howdiggy.
Thank you, Chair. And just a couple of questions. I know that you had mentioned you have about 44% of the facilities enrolled. I believe about 900 of them are actually, no, not 993 are eligible, and about 900 nursing students are eligible, but only about 123 have enrolled. Is there barriers to enrollment? Can you walk me through what the enrollment process looks like? Is the apprenticeship made available at their school, or do they have to go and find them on their own? I want to know why, like, out of 900 students, why only 120? Because this is an exciting program. I remember approving this in IFC and, spreading the word in my district about it. I would love more nursing students to take advantage of this, and it would help with some of that shortage in nursing workforce. So.
Lisa Sherrick for the record. So actually, January, it looks like there is 221 students now. So that's where there's been a pretty substantial increase from December from the entity that's administrating this program on behalf of the division. As far as the process, so the entity that's working on this grant for us, or the subaward, they work with the schools. They make sure that the schools are aware of the program. They're reaching out to the students. There's a lot of communication on that. They're going out to meet with the entities that are able to access this program for nurse apprentice, and so all that communication is occurring. Then once there's a determination that a nurse student is interested in working at a specific location or maybe in a specific area, they develop a negotiation or contract with that provider on what their hours would be, where their skill set is in their program, because they're only able to work up to the scope that they've been trained in so far in their schooling. And so all those pieces, have to come together for that. I think we've been pretty creative in making, we also work with the online schools to make sure that if there's students that are going to some online, that they can also participate in this. I don't know if that's answering all your questions. There was several embedded in there, so. Oh, I apologize. It was 210 students in January. This is why Ms. Reynolds is always so wonderful to me, my number person.
Do you have any follow-up?
No, I'm okay. I can probably just take it off. I don't know. We have many budgets.
Thank you. I appreciate that. I have a couple other questions. I'm first going to go to Assemblywoman Anderson and then to Senator Titus.
Thank you, Chair. My question has a little bit to do with this budget, but then also the prior one. You mentioned that there was a change of business practices that have been impacting the profession. Could you speak in particular to the traveling nurses and if that's having an impact as well in this program, or is it other areas that we need to be aware of? Because when you spoke about the analysis that's going to be coming up about how there's been a business practice change, I'm hearing from many that it's the traveling nurses. So just wanted to see if you could touch upon that.
Cody Finney for the record. Thank you. Yes. Particularly what we're referring to when we talk about the change in business practice here is related to that nursing pool regulation. And the mechanism by which travel nurses and others are connected with facilities that need workforce has changed significantly over the last several years, and we've seen the stand-up of models that are what I've referred to as Uber-like platforms, where they're connected. That is very difficult to regulate, and so what we're proposing with the nursing pool regulation is that HCQC wants to remain very focused on nursing pools that are providing particularly in-home services that are not associated with a medical facility. So when some kind of platform is connecting a hospital and a nurse from someplace, that hospital has responsibilities and significant regulation to make sure that that nurse has the appropriate credentials and experience. And we have a mechanism to regulate that. When we're talking about in-home nursing pool care, there isn't another layer there of regulation. And so we want to make sure we're focused on making sure that those nurses that are going to people's homes, particularly for infusion care and other sorts of in-home through a nursing pool, do have some oversight in our medical regulatory structure.
Thank you. Follow-up for me?
Yes, please.
So would these regulations then be brought forward to this body or to, I mean, where would the regulations be decided upon? Because absolutely, I think I understand what you're saying. But so at this time, there are no regulations when it is around this area?
Cody Finney, for the record, no. Thank you for allowing me to clarify. There are absolutely regulations around these areas, yes. What we're proposing is a simplification of the regulations so that it's very clear when we're calling something a nursing pool and when we're regulating it through a medical facility.
Thank you for that clarification, and thank you, Chair.
Senator Titus?
Thank you, Madam Chair. Actually, not a question, just an acknowledgement. Your division's decision to create the nurse apprentice program when we had such critical needs in Nevada, especially rural Nevada. So I just wanted to acknowledge how much it helped, not only for the nursing student, but to be able to make those decisions from a department. I see Director Whitley is back there, and I just want to acknowledge how important was. That really was a game changer during the acute crisis. So thank you very much.
Thank you. Any other further questions regarding this budget? Seeing none, I'm going to move on to our next one and open up budget 3218.
Okay. 3218, this is our public health preparedness, Lisa Sherrick for the record, public health preparedness budget. The activities accomplished through this program combine healthcare planning and response efforts of various disciplines across the state, such as public health, primary care, emergency management, community services, healthcare coalitions, and healthcare community and law enforcement. All activities and capabilities are compliant with the National Incident Management System as well. Slide 18. E225 includes a request to fund 90% of the Poison Control Services contract with General Fund. Only 10% of the Poison Control contract can be supported by the Public Health Emergency Preparedness Cooperative Agreement, and General Fund is requested to support the other 90%. E226 includes a request to support the Nevada Trauma Registry contract and existing supporting FTE. And with that, happy to answer any questions.
Do we have any questions regarding this budget? Seeing none, I think we will move on to our next one, which is 3219.
Lisa Sherrick for the record. The Biostatistics and Epidemiology budget account serves the Office of Public Health Investigations and Epidemiology, or we refer to it as OFE, and the Office of State Epidemiology, which is tasked with preventing and responding to a variety of public health issues through disease surveillance, data collection, meaningful interpretation, statewide standards, centralized guidance, and outbreak response protocols. Next slide. E225 requests to transition one contract business process analyst 1 to an FTE to coordinate the statewide system for disease management. And E226 and E490 request to align funding to funding for one existing grants and project analyst 2 with the CDC ELC grant or epidemiology lab capacity. And with that, happy to answer any questions.
I think we have one at least from Senator John Daraloop.
Thank you very much, Madam Chair. Can you give us a little bit of an update on the efforts and the anticipated timeline to fully expend the coronavirus state fiscal recovery funds? that were approved in October 2022 to support the infectious disease tracking and in building, kind of out that infrastructure?
Sure, Julia Peak for the record, and I do have our state epidemiologist sitting behind me in case you need a scientist, because I am not one.
Always need a scientist.
But I can talk money for sure. So much of that award has been given to the Nevada State Public Health Laboratory that works out of the University of Nevada, Reno. We are just finalizing the contract negotiations with them. We had some challenges around the indirect rate that has been resolved. We don't expect to not spend the awards. I believe they budgeted through 2024, and they expect to fully fund that award. That one's related to the genomics. If you'd like us to explain genomics, I will leave the seat and have Melissa sit here. There are several other projects that were funded in October. I believe monkeypox, and that one is set to be spent in this state fiscal year. Should be no issues spending that. That was working with a vendor to do some public outreach around vaccination and identification of the disease. And then we're also working with Silver State Equity to do some really targeted outreach for the population that could be most affected. We also just learned, related to monkeypox, that we will be getting a grant from the Centers for Disease Control and Prevention related to monkeypox vaccination, treatment, outreach, et cetera. So we'll be bringing that forward to IFC in April. So hopefully those efforts will continue. If I missed a project within the October IFC, happy to provide an update on that.
Thank you very much. I appreciate that information.
I'm not going to lie. I know that myself and Assemblywoman Gorlow were Googling what that was yesterday. I think we have another question, though, from Assemblywoman Howdigy.
Thank you. And I think the monkeypox allotment was at the summer IFC. I think the money that we had given in October was specifically for health infrastructure and then developing health workforce. So I know you had just mentioned that the money was going to be given to the Nevada State Public Health Laboratory at UNR. Can you walk us through how that is?
Yes, happy to, Julia Peak for the record. So you all approved, and thank you for that, money to focus on epidemiology and biostatistics. That's not necessarily going to UNR. We are going to an RFP for that. So I assume the universities will apply. No funding has been allocated to date. My intention is to get the RFP done in the next couple months with the anticipated awards starting about July 1st. And then we requested that go through an additional 2 years after that point. So it's about $2.5 million per year after I get the RFP done over the next few months. That funding is intended to get folks who might be interested in the field of epidemiology and biostats into a bachelor's program. If they have a bachelor's degree, looking to get them a master's. If they have the master's, potentially getting to upstaff to a PhD or a DRPH. Just helping to increase the pipeline to allow folks to move up within our public health agencies, or to get entry-level jobs if they'd like to just see if they like the field, to look at providing scholarships or tuition reimbursement. We also would like this RFP to include opportunities for internships and fellowships. So again, just letting folks get their foot in the door, and then we could see if this is the field they'd like to go into.
Do you have any follow-up? I'm sorry.
No, if you could just give me the dates. No, but yes. I just wanted the dates again of when the RFP was going out.
Julia Peak for the record, that's on my desk. So it's going to move as fast as possible during session. I'm hoping to get it out maybe in the next 6 to 8 weeks, and then allow folks to, again, bid for the next month, and then we'll have it go to a panel.
Do we have any further questions regarding this budget? Seeing none, I'm going to move on to budget 3220.
Lisa Sherrick for the record. This is our chronic disease program, and the program is focused on creating systems, environments, and policies that help people make healthy choices, reducing economic impact on chronic disease, and enhancing the quality of life to Nevadans. This section also has a specific focus on improving clinical linkages, statewide health promotion activities, and evaluation and surveillance activities pertaining to chronic disease. Slide 22, E225 requests funding for a Business Process Analyst 1 for the Clinical and Community Engagement Unit, and will support the Chronic Disease Prevention and Health Promotion section. E226 requests funding for the Wise Women's Health Connection Database maintenance costs. The program is currently using an Access database through RLS Consulting. Apologies, I don't know what that acronym stands for, and I could provide that afterwards, which requires manual data entry and reporting. The system had a module added that was rolled out to partners in September of 22, adding Wise Women to existing Women's Health Connection data efforts. The program is now working to move to Oxbow's Medical Information Tracking System, which is a proprietary database originally developed to support the Nevada Breast and Cervical Cancer and Wise Women programs. And with that, happy to answer any questions.
Thank you. I actually have a question on this one. Does the agency have a plan to submit a budget amendment to correct that revenue expenditure authority in the food security program and oral health programs?
Thank you, Debbie Reynolds, for the record. An adjustment is needed to the budget to reconcile to the Healthy Nevada Fund spending plan, and we are working with the Governor's Finance Office on the amendment process.
Thank you. I look forward to seeing that. Does anyone have any other questions regarding this budget? Nope, seeing none. We are going to move to 223.
Lisa Sherrick for the record. Budget account 3223 is our Office of Health Administration, which oversees the enforcement of all laws and regulations pertaining to public and behavioral health, along with ensuring adequate services are provided to persons with mental illness, substance use disorders, co-occurring disorders, and other related conditions. This office also supports the State Board of Health and Commission on Behavioral Health. Slide 24. We have E226, which requests the continuation of 10 intermittent fiscal FTEs to relieve the administrative burden of an increased workload. E230, which requests 1 new information technology professional 3 to support cybersecurity activities. Slide 25 has E231, which requests funding for ongoing maintenance for the electronic contract management system. E241 requests 2 new information technology professional 3s to provide ongoing technical support for the more than 60 systems used by the division. What did I miss? I don't think I went. Oh, sorry. And then E on slide 26, E242 requests 1 new personnel analyst 2 to address quality assurance investigations. And on the bottom of slide 26, leading into 27, we have E244, E245, E247, which include requesting funding for cybersecurity software to maintain and protect critical operations. And with that, happy to answer any questions.
Thank you. I actually, I hate to do this, but I know that we have a lot of new members to this committee, this subcommittee, including myself. And if we could go back to, I just have some questions about the food security program. And I was wondering if anyone could tell me about that. I see that there's one position, it's my understanding it's in the north. But if, before we ask some other questions regarding this budget, is there any way to go back to that and kind of answer and give some clarifying for that?
Julia Peak, for the record, just a general overview would be helpful, or?
Yeah, I think a high-level overview about the program and why there's one position, what that person does. I know they're, based in the north.
Yeah, Julia Peak, for the record. I'll start, and then I have my colleague Vicki Ives if you need more details that I can't provide. So as is noted in the title, this position and the program is really looking at food security statewide. So much of that work is done in working with our partners and providing that funding out to the community. We also have the Food Security Council that is a really great group of people that have subject matter expertise that provide us information and direction related to food security. So some of the projects we fund, for example, Catholic Charities of Northern Nevada, the Food Bank of Northern Nevada, the universities. So entities are funded throughout the state. The PCN associated with the position is able to devote her full time to looking at food security. If that's helpful, I can provide more information. If not.
No, I think that's super helpful. And I'm sure if there are committee members that have some more detailed questions about that, I'd ask you to reach out offline and get some of those details. But I think that's very helpful. Sorry about that. I'm going to go back into this budget, and I believe Assemblyman Watts has a question.
Thank you, Madam Chair. So it looks like in E230, there's a new IT position, and E241 has 2 IT positions. And you mentioned that there's more than 60 systems. I was just wondering if you could give us a little bit more background on how it was determined that that there was a need for those 3 IT positions, as well as the personnel analyst in E242.
Thank you. Debbie Reynolds for the record. With regard to our security position, we don't have a specific workload analysis. We're a large division with over 1,750 FTE and many contract staff. We have over 50 public health and clinical services programs, and as you mentioned, over 60 different technology applications. We currently only have 1 FTE that supports cybersecurity activities. In comparison to our sister division, one of our sister divisions who has 5. Regarding the positions that are requested to support applications, we did develop an application staffing calculator to assess the number of positions needed to support our large number of applications, and based on that calculator, we would need more than 20 information technology professional 3s. We currently have 8, and we're asking for 2. Going back to cybersecurity just a little bit, I would note that phishing, ransomware, data breaches are the top cyber threats for healthcare organizations. And according to a 2022 IBM data breach report, the average cost of a ransomware attack was $4.5 million, not including the cost of the actual ransom itself. It also noted that healthcare industry had the highest average cost of a data breach for 12 consecutive years in a row. Regarding the personnel analyst position, we average 27 investigations annually to ensure evidence exists when adverse disciplinary action is needed to address employee violations in the workplace. It takes an average of 4 to 6 weeks to complete an investigation. Currently, staff manage this as part of their existing workload, so we're requesting an additional position to support that activity on a full-time basis.
Go ahead.
Thank you for that. That's very helpful. And, you know, definitely we want to make sure that we're protecting folks' personal information from cyber attacks. Just, and this is probably a question that one of my colleagues has in mind, but how confident do you feel in our ability to hire those IT positions? I know that that the IT positions in particular are one that we struggle to recruit and retain.
Thank you, Debbie Reynolds for the record. Certainly, it's difficult to fill our IT positions. I can't guarantee that we're going to be able to fill them, but our staff do the best that they can to recruit to the fullest extent possible. Hopeful that this session there's some opportunity to incentivize more staff to join the state workforce.
Thank you. Assemblywoman Howdigi, please.
Thank you, Madam Chair. And my questions are just specific to Decision Unit E247. And so why are general fund appropriations being used for this decision unit as opposed to cost allocations?
Thank you, Debbie Reynolds for the record. An adjustment is needed to the budget. We should not have direct general fund in this account to support administrative oversight activities. It should be funded with cost allocation.
Okay, that answered both my questions, so I'm good. Thank you.
Thank you. It answered my question as well. Do we have any further questions regarding this budget before I move on to the next one? Looking around, seeing none, we are going to close that one and move on to 3224.
Lisa Sherrick for the record. This is our community health nursing program. We have registered nurses and advanced practice registered nurses who serve as a safety net resource and work to identify needs and fill the healthcare gaps in their communities. It is important to note that the RNs and APRNs are not primary care providers, though. Moving to slide 29. I have to second guess myself now because that one slide that was in there. E225 requests to fund 5% of 9 FTEs with state general fund due to the loss of the family planning grant. E490, request to eliminate the Family Planning Grant, or Title 10, which expires in March 2023. I would like to note that IFC did approve $6.4 million in ARPA from GFO to support reproductive health services for counties outside of Clark County. It ensures continuation of services formerly provided under the federal Title 10 grant, and it also provides funding for Central Nevada Health District member counties to develop a family planning and reproductive health program. ARPA funds will support these services through December of 2026, which allows these entities time to apply for the next Title 10 cycle for ongoing infrastructure and sustainability of services after ARPA concludes. And with that, happy to answer any questions.
Thank you. Assemblywoman Monroe Moreno.
Thank you, Madam Chair. With the creation of the Central Nevada Health District, you won't be receiving reimbursements from those counties, correct? Do I understand that correctly?
Debbie Reynolds, for the record, that's correct.
Okay. So then how much county assessment revenue do you expect to collect in FY24 and FY25?
Thank you, Debbie Reynolds, for the record. I believe it's approximately $400,000 per year.
And then if, this kind of seems like a reoccurring question in every budget that we've gone through today. So if the revenues that have been overstated in our backup documents, will there be a budget amendment coming to correct that action?
Thank you, Debbie Reynolds, for the record. Yes, an adjustment is needed to the budget to reconcile to the projected revenue after the creation of the Central Nevada Health District. And we are working with the Governor's Finance Office on the amendment process.
Thank you so much. You guys kind of have your hands full. We're going to have a lot of amendments coming from you. Thank you. Thank you, Madam Chair.
I think that's an understatement. Do we have any other questions from the committee regarding this budget? Okay, then if we could move on to 3234.
All right, Lisa Sherrick, for the record, we are, this is the Public Health Improvements Account, which would be overseen within the division's administrative unit. And we are requesting a new budget account for public health infrastructure and improvements. And this account will be dedicated to public health improvements, agency-wide projects, workforce and staffing projects, and other such overarching services. This budget account will improve ARPA investments in the local health departments, as well as data modernization to the outdated public health systems. This includes a focus on quality improvement and transparency through public health accreditation and investment in public health workforce projects. And with that, are there any questions on this budget account?
One second. I think I have some questions on there. I don't know if anyone else from the committee has any additional questions, but while they are thinking about that, can you provide a timeline on awarding and issuing the grants to local public health agencies and confirm whether or not that entire $20.8 million approved by the IFC for this program is going to be awarded? I know we have some upcoming briefing on like ARPA funds and unspent ARPA funds, but it appears like one of the previous budgets we looked at that there's 20.8 in this that has yet to be spent. Is that my understanding?
Yeah, Julia Peak for the record. I've been overseeing those 4 awards that will fall within the ARPA funding that was approved. It's for our local health departments. We're just about done with the Southern Nevada Health District subgrant. That's going to fund environmental health specialists. That will be fully expended by December of this calendar year. There are also staffing requests from Carson City Health and Human Services, primarily around continuing to support their minority health and equity positions. We do have a grant for that with COVID, but it's time ending. So their intention was to use these ARPA funds to continue that effort. That does have moving parts. We continue to get continuations of some of those NOGAs, and so we don't want to overlap with the ARPA, but they do intend to spend that through 2026. And it does fill, as I'm sure you can appreciate, a really huge gap in the community. The two larger projects are related to buildings, and so that's the Central Nevada Health District. They're going to be building at least a clinical care center for the health district with some office space. They do plan to have that fully completed by 2026. We won't have any savings in that. The last project is for the Washoe County Health District, also building. They're in the process right now of figuring out the land to purchase or to utilize for that building. It's going to have an infectious disease clinic plus a tuberculosis clinic. They fully intend to spend the $10 million as well, and they've budgeted that through 2026.
So it's fair to say that most of these are one-shot capital improvement projects, and it's just taking some time to get that money out the door.
Yeah, Julia Peak for the record. Very fair to say. Also, having to do a lot of research on building projects and how we fund those from the state. This is my first attempt to oversee awards for building projects.
You do have a lot on your hands. You kind of answered this, but if the new budget is approved and funded with the ARPA coronavirus state fiscal recovery funds, does the agency intend to change indirect on this budget for fiscal year 24 and 25?
Thank you, Debbie Reynolds, for the record. Yes, if this budget account is approved, we would include this budget account in our indirect cost rate proposal that's due to the federal government at the end of December. And if that's approved, that would allow us to charge indirect in this account. If it were in 3234, if it stays in the administrative account, we were unable to collect indirect on that.
Any additional follow-up questions regarding this budget? Okay. Look at this. I almost feel like I moved everyone too fast, although if we can move on to our next budget, then 3235.
Okay, Lisa Sherrick for the record. This slide provides an overview of the Emergency Medical Services Program, which establishes and enforces standards for the provision of quality out-of-hospital emergency care, the operation of ambulance services, certification of emergency medical technicians, licensure of attendants, and the delivery of trauma care. This program also supports the emergency medical services system for Nevada's 15 rural counties and Washoe County by providing technical assistance, consultation, and training to EMS managers and personnel and public officials. The next slide, E225 includes a request to balance forward all fees and additional funds to support the software program used to track and record training and certification for EMTs in the state. And E226 requests additional state general fund to support a web-based electronic software platform used to track and record training and certifications for EMTs in the state. And with that, happy to answer any questions.
That was pretty straightforward, but does anyone have any questions from the committee regarding that budget? Seeing none, I will thank you. It looks like that brings us to the end of all 12 of them. Before you guys leave the stage there, does anyone in the committee have any questions regarding these budgets? It is like a stage. With that, seeing none, we will now close the budget hearings for today. Thank you guys for coming in here, and thank you for everything that you do. I know that is greatly appreciated. And yeah, we look forward to working with you throughout this session here. At this time, I will open up public comment. Because of time considerations, persons offering public comment will be limited to not more than 2 minutes. I'd remind everyone to please state and spell your name for the record. To provide public comment by telephone, dial 669-900-6833. When prompted to provide the meeting ID, enter 898-625-66098 and then press pound. When prompted for a participation ID, press pound. All of that information you did not have to memorize is also at the bottom of the agenda posted on our website. But I will start here for public comment in Carson City. Don't everyone all run up at once. Seeing none, I will look to Las Vegas. I don't see anyone there at the table as well. So if we can see if I can ask Broadcast Services, do we have anyone on the line for public comment?
Thank you, Chairwoman. The public lines are open and working. However, there are no callers to offer public comment at this time.
Wonderful. I will close public comment at this time. Thank you all, and meeting adjourned. I know.